Hi, I'm Dr. Raj Kakar. I'm the medical director at Dallas Sleep here in Plano, Texas. Today I wanted to talk about the health care in America. Obviously this is a big topic. People everywhere are being affected by this on a daily basis, and it's affecting all Americans really in one way or another. And as we all know, the costs are really unsustainable at this point, whether you're for or against the Affordable Care Act, known as Obamacare. It's still experienced by everybody that the costs are just rising, and the health care being provided is just not at the same level or to the same extent that it had been in years past. So there's clearly an issue. Physician, I've talked to so many patients and really other physicians and business professionals, and we all see that every year everybody's premiums are rising 10 to 20% annually, and all of our deductibles are increasing every year, and now walking around with a deductible of $5,000 is commonplace. And obviously that's a lot of money, and for routine preventative care most people don't reach that. And for those that do, it's all coming out of their pocket, so it's very expensive. So what we're seeing is less and less people are really willing to pay for the routine or preventative care that they need. They're really pushing that off and then really increasing the risk for more serious problems and issues that come up later. So this is a non-sustainable program. I've also talked to a lot of business owners, as I was mentioning, and with business owners, small business owners especially, which are really the heart of this country, they're having a hard time making ends meet. Many business owners, small business owners especially, try to offer healthcare insurance to pay at least for part or all of it for their employees, and we do the same. And it's becoming more and more difficult with these rising premiums that are really astronomical, that have been going up by 10 to 20% annually over the last several years. So now it's to the point where not only myself, but several other business owners that I've talked to are having difficulty really being able to manage that and to maintain that. So we're getting to the point where can we even afford to continue to offer health insurance to our employees and to pay for some of that, if not all of it, even some of it is a challenge because of such high astronomical costs. So that's really the biggest issue that we're facing. I think really the real issue with healthcare reform, it's a misnomer. It's the wrong name, and it's the wrong issue that Congress and our country are trying to fix. It should be health insurance reform. That's what we really need in America, is health insurance reform. That's the problem. So I think there's a couple of different things that need to be done to really improve this. Recently, unfortunately, or fortunately, whichever way you look at it, the health care plan that was offered up to Congress didn't pass, and for good reason. It really didn't address the problems that I'm discussing with you today. It didn't address the rising costs. It didn't promise lower premiums. It didn't promise a cap on deductibles, the high deductibles that we're seeing. And also it was further decreasing access to some people and parts of our country. So those aren't good things. So there needs to be improvements in these areas. So number one, I would recommend that we put a cap on premiums. The premiums should be capped at 2 to 3% annually. That's more realistic, as in every other industry in America. And by having premiums rise by 10 to 20% annually is really ridiculous and non-sustainable. People just aren't going to be able to afford it. The second thing that should be done is there should be a limit on deductibles. And really, deductibles should be brought down. $5,000, $10,000 deductibles are ridiculous. Really, people are using their insurance really just for catastrophic emergency care. And that's really what a lot of our patients are doing. Many patients we have who have insurance are preferring not to use their insurance. They rather pay for their services out of their own pocket outside of insurance because they're able to get lower discount pricing on that versus going through their own insurance, which they're paying high premiums for. But because their deductibles are so high, they can't use it. So what good is that? Then the insurance is really just for catastrophic emergency care. So if that's really what it's for, then let's call it that correctly and make it clear that this type of insurance is for catastrophic health insurance, and other type of insurance, if there is any, is for routine preventative care. So maybe we need to split the two apart. If we're going to keep them combined, then we have to put some reasonable limits on it as far as the premiums rising and the deductibles that are so high and non-sustainable. And then finally, there is also the request and need for those people that maybe not have access to health insurance because they can't afford it. We want everybody to be covered. We want to continue to not exclude any pre-existing conditions that may be there. People shouldn't be excluded from insurance for having pre-existing conditions. And I think most Americans are happy with those changes recently. But for those people that can't afford insurance, I think Medicare should be opened up to those people so that Medicare can offer them at least some way of getting health insurance at a reasonable cost. I'm not saying that the government should pay for it completely, but at least there should be some discounted pricing for those people that just need routine preventative care or even catastrophic care through Medicare or some government health insurance entity. And really, why not let the government health insurance provide an option and let the private insurers compete with that? That would help to reduce some of the cost and rein in some of the high costs that people are experiencing today. So I think those are really the biggest problems we have. It's not really so much with health care in America, it's with health care insurance in America. That's the real issue. And unless we address that, nothing is going to change. And more people are going to continue to have astronomical expenses, out-of-pocket expenses, and just can't afford to pay for their medications, to pay for their routine preventative health care, doctor's visits, routine procedures that need to be done. So these are really the issues that face our country and our Congress and our president right now. I think the president is trying to make the changes for the right reasons, but Congress has to step up and do the right thing. And I hope that in the near future we will see some of these changes implemented and the focus really put on health insurance reform. I think that'll give us the most improvement and the biggest results for everybody nationwide. Thank you.